It's time for the KBOI Medical Moment, brought to you by Regions Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regions. Dr. Bramwell, good morning.
Good morning.
Dr. Bramwell, a lot of us instinctively start our days by reaching for that first cup of piping hot coffee, and then we often grab another and another to get us through other times in the day when we feel that we need a boost. But you say that we need to start thinking more about how much we consume, almost to the point of counting our number of daily cups?
Yes. When it comes to caffeine, the active ingredient in coffee and sodas and many energy drinks, we can reach an upper limit.
So for those who might already be on their second cup at this hour of the morning, when is it time to hit the brakes and shift to maybe a non-caffeinated beverage?
Well, the counsel coming from a newly published report says that real risks start increasing for most people after their fifth cup of coffee. By looking at the coffee consumption habits of nearly 350,000 people between the ages of 37 and 73, researchers found a tipping point at the sixth cup. That's where they say they noted up to a 22% increase in the risk of cardiovascular disease.
All right, changing up topics here just a little bit. Our next topic of discussion this morning includes a term most of us probably aren't too familiar with, and that's ultra-processed foods. What are some examples of this kind of food?
Well, ultra-processed foods are those that have been significantly augmented, often with additives with questionable nutritional value. Think of foods that list ingredients such as hydrogenated oils, emulsifiers, high fructose corn syrup, and flavoring chemicals.
Well, what's the issue with those foods?
Well, the National Institutes of Health says it's now been proven that ultra-processed foods can cause people to eat too many calories and to gain weight. It's yet another validation of the value of eating a balanced diet that includes fresh fruits and vegetables, whole grains, and other minimally processed or unprocessed foods.
Finally today, Doctor, a lot of guys get a lot of grief for having mustaches, but it turns out people like Tom Selleck and Coach Andy Reid, who've sported hair on their upper lips as long as anyone can recall, are actually being good health trendsetters. Can you tell us more?
Yeah, this is a fun one. You know, most of us work with or are related to or otherwise know somebody who seems like they've always had a mustache. And although they may regularly get teased for having the cookie duster, it turns out there's a real health benefit that they enjoy.
I've got to hear this. What is it?
Yes. The director of dermatology with the University of Kansas Health System says in much the same way that a thick head of hair helps protect the scalp from damaging rays of the sun, men's mustaches can help guard against lip cancer. Specifically, it was shown that years of mustache wearing ultimately translated into a 16-time lower risk for developing actinic keratosis, which is a scaly spot on the skin that can develop into cancer. The finding held up even after accounting for other risk factors such as family history of skin cancer, personal history of sunburns, smoking history, and age. As a colleague of mine notes, clearly it's time to give the mustache a little respect.
Well, Doctor, I'm all in favor of that. That's good news. Thank you, Dr. Bramwell, for joining us this morning on KBOI.